Hey, my name is Austin Norris. I'm a strength coach, therapeutic exercise specialist, and registered massage therapist here in Toronto, Ontario. Today I'm here with Eman at Dancing in Circles Studio, and we're going to teach you how to do an L5S1 ELDOA. Now, for those of you who are unfamiliar, ELDOA is a French osteopathic movement therapy system designed to decompress your joints. And what's cool about ELDOA is that it's an active practice. So you're going to build the strength and sensory awareness to maintain that decompression, unlike an inversion table where as soon as you're right side up, gravity's got the best of you again. So ELDOA is a fantastic series to learn if you're suffering from a disc herniation, facet irritation, or just have a lot of chronic low back tension. So let's just get right into it, and then we can discuss more when we're done. So to begin, we're going to bring a yoga mat to the wall because we're going to be using a wall to support the legs in this exercise. Now, the best way to get your feet up on the wall while getting your butt as close to the wall is to start in a side-lying fetal position towards the end of your mat. And now we're just going to do a little 90-degree flip here. Bring the feet up to the wall. All right. So from this position, the first thing we need to do is create our fixed point for traction. And that's the sacrum, the S1. So to do that, we need to make sure the sacrum is flat on the ground. So if your hamstrings are tight, you might need to scoot your butt back away from the wall until you can both lock your knees and maintain that sacral contact. Now that you've done that, we're going to do internal rotation of the hips. So we're going to take the knees and we're going to try to get them to point towards each other. And now from here, we're going to pull the toes down towards you into this dorsiflexion. Now, to really fix that sacrum into the ground, we're going to create counter tension. And the way we're going to do that is we're going to think about reaching up through the heels of the feet and then thinking about pressing the sacrum into the ground. Okay, now that we've done this, we're going to bring the arms up over the shoulders. I want you to kind of wiggle around a little bit if you need to get your whole spine flat against the ground. Try to get as much spinal contact as possible. All right, now from here, reaching up as hard as you can, spreading the blades off the rib cage. You're going to perform wrist extension and external rotation. It's going to bind fascia tension into the upper body. And now from here, we're going to tuck the chin, try to press the back of the neck into the ground. Good. And now from here, we're actually going to put a stretch on the dura mater, the protective sheath along the spinal cord, connecting to the cranium, by looking down between the knees of the eyeballs, and then lifting the eyebrows up. Eyeballs down, eyebrows up. Okay, now that we've done this, we're going to slowly start to reach the arms back overhead. Good. Now we're keeping that sacral contact. And you're reaching as hard as you can. You're reaching so hard, you're pulling the arms off the shoulder blades off the rib cage off the pelvis, thus decompressing the lumbar spine. Now we have our feet up on the wall because we don't want to use the core. If we're just lifting our legs up, the core is engaged, but because the core is between the ribs and the pelvis, it's going to compress the spine, defeating the purpose of the exercise. So try to find some softness there in your belly. And you're going to hold this for 60 to 90 seconds, working as hard as you can. That's the L5S1 ELDOA. All right, so there you have it, the L5S1 ELDOA. A couple things to keep in mind. One of them, it's a good idea to do a warm-up before you do ELDOA because the fascia is most supple when it's warm. So whether that be a hot shower or a sauna or an osteoarticular warm-up, that would be a good idea beforehand. Also, contraindication-wise, if you have a fracture, if you have localized inflammation in the spine, it's probably a good idea to get that sorted out first before exploring this because it might irritate it. But otherwise, the L5S1 ELDOA is probably the #1 exercise that I would prescribe to treat low back tension, low back pain, low back injury. So do give it a shot. Let me know what you think. If you enjoyed this video, consider subscribing to my YouTube channel. You can also find some free workouts and more detailed tutorials on my Patreon channel at patreon.com/circularmotion, where I post up weekly calisthenics exercises as well as weekly tutorials for ELDOA and other corrective exercise series. And all of those exercises are designed with lockdown in mind, so you don't really need any equipment for those workouts, and it's only $15 a month. So yeah, let me know what you guys think. Hit me up in the comment section below, and I hope to catch you again soon.